This is VOA Africa.
I'm Esther Githui-Ewart. It's Wednesday, July 8th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. As the United States closes in on a whopping 3 million total coronavirus cases Wednesday, the nation's top infectious disease expert is warning Americans not to fall into a false complacency about the nation's falling death rate from the coronavirus pandemic. Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, made the remarks Tuesday during a question and answer session with U.S. Senator Doug Jones on Facebook. The U.S. has topped 131,000 deaths from COVID-19, according to Johns Hopkins University. President Donald Trump, however, said late Tuesday night on Twitter, quote, "The death rate from coronavirus is down tenfold." Dr. Fauci's latest warning on the coronavirus outbreak in the U.S. comes as the White House formally notified the United Nations it is withdrawing from the World Health Organization despite the surging number of COVID-19 cases across the country. Turning now to Africa, where the shortage of reliable data on COVID-19 is affecting many African nations, as some governments are reluctant to acknowledge epidemics or to expose their poor health systems to outside scrutiny, according to Reuters. Other nations are finding it difficult to administer significant testing because they are so stricken by poverty and conflict, according to data collected by Reuters. Africa, with 1.3 billion people, has over 493,000 infections and more than 11,000 deaths. WHO Special Envoy Samba Sow has warned of a silent epidemic across Africa if coronavirus testing is not prioritized. The COVID-19 vaccine trial in South Africa has been subject to some protest, and experts note a significant level of resistance and mistrust around testing on the continent. In part two of Africa Health correspondent Linord Moudou's interview with Dr. Bartholomew Dicky Akanmori, regional advisor for regulations of vaccines with the WHO's Regional Office for Africa, also in charge of the Secretariat for the African Vaccine Regulatory Forum, he elaborates on the importance of Africa to participate in clinical trials.
Why is it important for the African continent to participate in the global search for new therapies? Why is it important for clinical trials to also happen on the African continent?
When clinical trials take place, they take place in a country, in a population, that the product is actually being evaluated within that population. Now, if Africans leave themselves, stay out of the evaluation of products, then these products don't actually get tested in African populations within African settings or context. And that then means that when the product is eventually introduced, we may never know about events that could arise in special populations within the continent, who may not be the same as populations elsewhere where the product was evaluated clinically. So it's important for us to participate in these studies so that at the end, the product which is licensed would be one that is suitable for our use without giving us any adverse events.
What is your message to those who are still skeptical, remembering cases where, for example, in 2005, there was an HIV trial of tenofovir that was highly criticized for reasons such as ethics and safety? There are other examples as well.
As you rightly pointed out, history has bad examples of research, and it's not just on our continent. It's actually global in other countries as well. We've had in the United States of America, there were studies many, many years ago which also violated the rights of research subjects, where research was not properly conducted, where research participants were not given the care they required. And indeed, in some cases, some harm was done to research participants.
Tuskegee experiment, for example.
Yes. Now, in Africa, the systems are in place to safeguard and protect the rights of research subjects. That the expertise is available, the infrastructure is in place, and that there are also legally established institutions that look over research. People should feel more confident about participating in research.
How can the trust be rebuilt, given how much mistrust there is around clinical trials as well as vaccines?
We need to continue to educate people. We need to reach out to people, let them understand that health products save lives. Vaccines save millions of lives every day. And vaccines have to be developed for diseases as we get, new diseases coming up. And there's a need to be involved in the development process, because the vaccine that we help develop today may be the vaccine that will save your own relatives, family, friends.
Now, for those who are looking forward to the vaccine, there have been some concerns about the accessibility and affordability of a COVID-19 vaccine to Africa when it becomes available. What is being done to ensure that African countries are not at the end of the line for access to the vaccine when it's released?
There is actually a framework for accessibility and allocation of vaccines, which has been developed by WHO. And this covers all the essential considerations in terms of who are the vulnerable populations, who need to get vaccines first, health, to protect health workers and make sure that we secure our health systems. But it's going to also take a lot of advocacy, a call to make sure that there is access to people who may not have the resources to purchase these vaccines. And we in Africa belong to that category. And I think that the African leaders have called for this. The regional director of the World Health Organization, the regional office in Africa has called for this. And all over the world, the European Union and other countries have also added their voice to making sure that there is equitable access to vaccines.
That was Africa 54's Linord Moudou speaking with Dr. Bartholomew Dicky Akanmori, Regional Advisor for Regulations of Vaccines with the World Health Organization's Regional Office for Africa. As Ghana's confirmed COVID-19 cases continue to rise, the government is urging citizens to take their health seriously and exercise regularly. Although social distancing is going to the gym a challenge, health experts say fancy equipment is not needed. Gyms and personal trainers are switching to online exercise classes, while a popular Ghanaian bodybuilder shows you can exercise from anywhere during the pandemic. Stacey Knott reports from Accra.
Before the COVID-19 pandemic, this gym in the Ghanaian capital would see up to 130 members per day. But with fewer people using the gym, Pippa's Health Centre is now also offering online classes and aerobics using Azonto, a Ghanaian dance.
Azonto is something that, the kids can do at home, mom can do, grandma, grandpa, everybody can get involved as a family event. So we thought it would just be a fun, light way of getting people up because we know, again, during C-19, a lot of people have become couch potatoes, sitting down, much less active.
Ghana's government is stressing fitness as a way to stay healthy against COVID-19. Gyms have reopened in Ghana, but bodybuilder and school teacher Samuel Kilbiller says the pandemic shouldn't stop people around the world from working out. He created a home workout guide online and has a global following on social media.
I started getting a lot of messages, DMs and emails, people telling me to help them because their gyms have been closed and they normally see me training at the kind of backyard gyms and they believe I can fix something.
Before COVID-19 hit Ghana, fitness coach and mother of two, Mabena Antri, held boot camps for women. She also moved her coaching online and enjoys working from home as she can spend more time with her kids.
I'm home, so, I'm able to, I think, give them a little bit more of attention and still work, even though it's not, fetching as much, it's still very lucrative and it's good. And I'm looking at definitely keeping the online classes.
These Ghanaian fitness coaches have made the best out of social distancing to promote exercise online. But they also hope the motivation and encouragement from the government to stay fit will continue once the pandemic is over. Stacey Knott for VOA News, Accra.
Under the diversity visa program, tens of thousands of potential immigrants literally rely on the luck of the draw to get the opportunity to legally live and work in the United States without sponsorship from an employer or family member. Now that program is being temporarily discontinued by the White House because of the COVID-19 pandemic. But for some who applied for and received diversity visas late last year, their search for the American dream is difficult. VOA's Linord Moudou explains.
After obtaining a diversity visa, also known as the Green Card Lottery, Eric Alamsyah came to the U.S. from Indonesia at the end of 2019 with his wife Sari and 2 children. He used to work in the IT sector for 8 years in the Indonesian capital, Jakarta. But even with extensive work experience, he still has not been able to find a full-time job.
Out of all the applications I sent, whether retail or other jobs in the IT field, I only get callbacks from essential jobs, like in the pharmacies, grocery stores, and home improvement stores. Maybe I have to put my search on hold to find the other IT jobs.
In the meantime, just to get by, Alamsyah is working as a cashier at a Home Depot store, a hardware outlet in the state of Maryland. It's considered an essential business that's still operating in the middle of the pandemic.
Hi, saya Agnes.
Vinia Agnesia was also a Green Card Lottery winner from Indonesia. She took leave from her final year as a dentistry student in Padang on the island of Sumatra to move to New York City by herself at the end of 2019. With no college degree nor work experience, Agnesia found it difficult to find a full-time job. She worked part-time as a server in a Japanese restaurant for a few months until it was closed due to the lockdown. She found herself unemployed in the U.S. at the epicenter of a pandemic in one of the most expensive cities in the world.
Bukan cuma soal coronanya aja.
My parents are worried about me, not only because of the coronavirus, but financially as well, because I'm unemployed. They are worried thinking how I can get by. And then I told them, don't worry, I'm legal here, so I am eligible to get government assistance.
The assistance she's referring to is the $1,200 stimulus check, as well as the pandemic unemployment assistance. Under the PUA, Agnesia receives about $600 every week, which she uses to pay rent, utilities, food and transportation while searching for work. Meanwhile, the Alamsyah family remains optimistic about living a new life in America in the midst of uncertainties.
We came here for our children, for our children's education. We have already made our decision, so we have to go through it no matter what. I just hope things will get better.
The Alamsyah family and Agnesia are some of about 55,000 people that come to the U.S. every year through the Green Card Lottery, many of them now just trying to survive. In Maryland, Fina Muptadi, VOA News.
Doctors in Sierra Leone say they will expand their strike to include treatment for general patients if the government does not meet their demands. The doctors went on strike last Thursday, refusing to treat COVID-19 patients until the government paid them their bonuses and provided more protective equipment. Sierra Leone government officials did not immediately respond to our request for an interview. Sierra Leone has registered more than 1,500 COVID-19 cases, including 62 deaths. Dr. Delwyn Finlay, president of the Sierra Leone Medical and Dental Association, says doctors care about their patients, But now the ball is in the government's court. We'll be right back.
Hello, I'm Linord Moudou, your VOA health correspondent.
Let us be perfectly clear. All countries.
During the COVID-19 pandemic, the World Health Organization says there is no information or evidence suggesting that the coronavirus can be transmitted by mosquitoes.
There are 2 published studies.
It is a respiratory virus which spreads primarily through droplets, generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose.
This happened during pandemics in the past.
For more information on COVID-19, visit who.int or contact your local or national health authorities.
Welcome back to Africa 54. Despite a recent surge in the U.S. coronavirus cases in a series of events at the White House Tuesday, the administration of President Donald Trump continues its push for schools to reopen for what it says is the holistic health of the nation. White House correspondent Patsy Widakuswara has more.
In the state of New Hampshire, a school using ski lifts for a graduation ceremony to help maintain social distancing. Just one of the creative measures American schools have taken during the pandemic. But beyond pomp and circumstance, American schools may soon reopen for a new school year. President Trump is demanding that it happen on time in August or September.
We're very much going to put pressure on governors and everybody else to open the schools.
Schools are part of the president's larger plan to resume normal economic function as he eyes his re-election bid in November. Children back in school would allow parents to go back to their workplaces. The more than 50 million children who attend school in the U.S. did so online after the pandemic hit and before their summer vacations. The American Academy of Pediatrics has recommended they return to school in some form to keep them from falling behind, a recommendation supported by infectious disease experts.
I think most of us agreed that we have to open up our schools again this fall, but we'll see exactly how to do it. Doing it carefully is very important.
But according to a research by the American Enterprise Institute, only 20% of parents feel safe sending their children back to a school building. Republican parents are twice as likely as Democrats to feel okay doing so. Mixed messaging from federal and state officials on precautions such as masks have contributed to parents' anxiety.
Reopening of schools isn't just purely a decision that's made by governors and superintendents and principals and teachers. It's a decision that parents have to participate in as well. They have to trust that the schools are putting in place the protections that are going to keep their kids safe. And the problem is when you have conflicting guidance, it creates this untenable situation for parents to try to make a decision with varying types of conflicting guidance on whether or not a school should do X, Y, or Z.
While the coronavirus rarely causes illness in children, there is concern they may transmit the virus to family members like they do with the flu.
We don't know that yet about the COVID virus. Does it really infect the children and they can transmit it? Or is it very difficult for this virus to infect children? Those studies are still underway.
Beyond the $13 billion allocated in April to help schools and universities move to online learning, it's unclear whether the federal government plans to provide additional funding to safely reopen schools. Patsy Widakuswara, VOA News.
As the number of COVID-19 cases continue to rise in the United States, theater producers are seeking ways to stay connected to their art and audience and keep actors employed. Dina Mitchell explores what happens when the show that must go on struggles during a pandemic.
It was really heartbreaking. I knew people that were in the middle of production, or I think there were at least a couple shows I knew people that had just opened. They just got one night. Opening night was their closing night.
COVID-19 hit the theater industry hard. As cases increase around the United States, many Broadway productions and regional theater are postponing until spring 2021, or even longer.
The American theaters, our audiences tend to be older, and so they fall into the high-risk category. The theater won't come back until the audiences are ready to come back, and that may actually demand either a vaccine or some kind of therapy.
Many regional theaters, like those in the San Francisco Bay Area, are nonprofits and run on tight budgets. While so many are out of work, Those who have the resources to are drawing on their ingenuity to live up to the adage, the show must go on.
Because we are nonprofit theaters, we are mission-driven. From our perspective, it's less about how many tickets we can sell and much more about getting these stories out there, about creating these experiences for our audiences.
Jim Kleinman, who runs a large theater festival, switched his entire operation to Zoom, calling it Playground Zoom Fest.
Still about sharing the energy of creating something that you're seeing as it's happening. If the actor misses a line or if a technical flub happens and the virtual background doesn't click on, that's just like when a light cue is missed or a sound cue is missed, and we still keep performing.
Everyone admits this is not a replacement for live.
That live experience of being in a space, whether it's a concert or a play or a dance, we call it the collective breath. It's when everyone suddenly catches their breath at a moment because you're all seeing the same thing and you're all having that same experience. And you just can't synchronize that across Zoom.
Hopefully this new platform for productions extends a lifeline to the community that lasts until it is safe to come together again. For VOA News, Dina Mitchell, Oakland, California.
Opposition and pro-democracy groups in Mali say they will resume their protest this Friday to force the resignation of President Ibrahim Boubacar Keïta because they say he failed to meet their demands. Ramata Sissoko Cissé, president of the Change in Mali movement, says the protest will from now on take the form of peaceful civil disobedience, including occupation of all government buildings and other institutions throughout the country. In addition to their demand for the president to step down, the protesters are also demanding an appointment of a prime minister from the opposition, dissolution of the National Assembly, and replacing it with a transitional legislative body. President Keïta has been negotiating with the protesters, but through the ruling Rally for Mali party. Cissé says the protesters want to negotiate directly with the president. In our tech report, Rwanda, like most African countries, is gradually reopening its economy after several weeks of being locked down due to the coronavirus pandemic. Small businesses and startups are struggling to stay in business. Africa 54 tech reporter Paul Ndiho spoke with Jennifer Batamuliza, founder RWA Tech Hub, a startup that teaches IT and mentors women and girls to enter the field of science and technology.
Jennifer Batamuliza, welcome to Africa 54.
Thank you.
You run World Tech Hub in Rwanda. How have you been able to survive under COVID? What is it that you've done differently to make sure that your business and your school stays afloat?
World Tech Hub teaches the girls and women physically. But now with the pandemic, we had to teach the girls from home. So we had to introduce the online teaching so that our work can continue as it was before. So we are teaching online.
How has that transition been? How was everybody able to get up to speed when I introduced this new system?
So it wasn't easy. I can say for some women and girls, it wasn't easy for them in that others even ended up not studying because others don't have the devices. Others, they don't have connectivity. They don't have internet. So it has been really bad because some of my girls just missed the chance of studying just because of lacking the devices and the internet connectivity. So it's not easy and things are not the way they used to be.
Is the lockdown still going on in Rwanda?
So in Rwanda now we are having partial lockdown. So we are having curfews like from 5 a.m. in the morning up to 3 p.m. and people are putting on masks and we are keeping social distancing and also people are washing hands. So that's how we are in Rwanda. We are trying to keep up with COVID. And another thing that we are doing is that some people are going to work, but only essential staff are going to work. Others work from home remotely. Yeah, that's how things are being done.
How has COVID-19 affected the tech community or your business in general?
So my business has been really affected because before COVID-19, I used to meet my clients or my people, I used to interact with them physically, but now I have to interact with them. I have to interact with them remotely, and it's a very big challenge. So another thing our businesses are facing is that with people working remotely, so these security issues has just increased because now the hackers are trying to hack the devices because now we are online, like in everything. So those are some of the challenges. So COVID-19 has really affected us. It has affected the business very, very hard.
What lessons have you learned from this whole experience?
For me, what I've learned is that everything is possible. Like, we didn't know that life can change just in a blink of an eye. So for sure, I've learned a lesson of like expecting anything at any time and always being ready to solve any problem that could arise at any time.
How many girls are in your tech hub?
I only train girls and women. Those are the only people I train. And when I was training physically, I used to train more than 50 girls at a time, at one time. But now I can only train like 20 or 25 because it's not easy to train them online. And sometimes they have problems and it's not easy to troubleshoot the problem on their side.
A lot of observers have credited your president, His Excellency Paul Kagame, as a visionary who has done so much for that country. To what extent has he helped you as a person and the women that you help try to acquire some of these skills?
Our president has done a lot. He wants to see the women on the same level as men. What I can say is that you know that our parliament, we have many women in parliament than any other country in Africa and even worldwide, I think. We have the biggest number of women in the parliament. So he has really done a lot to see the women just at the same place with men. So they've really empowered women. And in Rwanda, we have many associations that are trying to empower women at all sectors, like in private sector, in government, and in all sectors. And Rwanda is also putting more effort in STEM. They want many girls to be in STEM fields. So there are many scholarships for girls and women who want to go to study abroad.
Thank you so much for your time.
Thank you so much. Thank you for hosting me.
That was Africa 54's tech reporter Paul Ndiho speaking to Jennifer Batamuliza, founder of the RWA Tech Hub. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thank you for watching.